Hey there, I'm Dr. Chris Rayo here with Unison Pro-Youth Institute, and this is the newest edition of the Men's Health Book, the Midlife Health Guide for Men. The first edition being in 2007 when they had no men's health books out and nothing about middle age then that I call midlife. So middle age is when the time for us guys to get in shape. You want the golden years to be truly golden, right? Not to spend all your gold on being sick or being too sick to enjoy your gold, giving it all to doctors and hospitals and drug companies and such. So we work on optimal health from the inside out, not the outside in. It's not a band-aid approach. Part of that, this will be about testosterone replacement therapy in men, just as important for women, but that's another topic. It just so happens as we age, the hormones that you wish would go up go down, and the ones you wish would go down go up. The ones that go down include HGH, testosterone, DHEA, and all of that. It's all explained in the book, The Midlife Health Guide for Men. And the ones you wish would go down go up, insulin and cortisol. When those go up, increased risk for metabolic syndrome, which is increase in visceral fat, high blood pressure risk, metabolic syndrome, diabetes, pre-diabetes, and hyperlipidemia. Almost impossible to walk in a doctor's office today and not walk out with a blood pressure pill and a statin drug, right? Well, anyway, so first of all, how to know if you're low in testosterone. The symptoms are very vague and they're very slow in onset, probably starting off in the 30s. Very hard to keep the muscle mass up, the abs, people start getting the granddad bod and the dad bod, that visceral fat, fatigue, can't sleep well, on edge, the grumpy middle-aged guy or older guy and such. All that occurs first. One of the last things to go is erectile dysfunction. So don't wait until then, okay? Testing to check your testosterone level, and you want to be, when we go to replace it, you want to be in the optimal range. It's the same range for a man from 25 to 100 years old. The optimal range is 750 to 1,000. If you have the symptoms and testosterone is low, to replace it makes sense, or at least to consider that, okay? Just like with the thyroid or anything else. Amazingly, it's still cutting edge. Insurance most of the time won't pay for the testosterone. I think that's totally ridiculous. Luckily, it's pretty cheap. You can get a 10 ml vial of testosterone now for about $40. Ways to replace testosterone. Ways to replace it. So you don't want to do it orally because it's hepatotoxic. All right. So it's going to be parenteral besides oral. So it can be done by pellets. And in the book, it explains the benefits and the risks of all this. Pellets can be also replaced by intramuscular injections, which can typically be 1 to 2 weeks interval. And the third would be topical gels. If your testosterone is low, probably the gel is not going to get you to the levels that you have to be. So it's very important to individually assess the benefits and risks for you to check these and to replace if it's indicated. Very important to monitor things. Of course, the prostate with the PSA blood test. Actually, low testosterone is a risk factor for prostate cancer. However, for a person who has prostate cancer, we wouldn't want to replace testosterone because the way it helps you grow, it helps the prostate cancer to metastasize some. So it has to be individualized. Safety, especially with Unison Pro-Youth Institute and myself, that I've done this for over 3 decades. I've taught worldwide physicians through the NPI, the National Procedures Institute, the A4M and all that, began this wave of, of this paradigm shift to optimize your health, treating the root cause as opposed to treating the many symptoms of inflammation and the hormonal changes which occur as we age. And again, to replace testosterone is only part of an individualized approach. You have to have the proper diet that keeps insulin and cortisol low, and the proper exercise that's going to help you with interval exercise and such, say, to work from the core to the floor, working on the glutes, hip mobility, and all that. So the last take-home message is this, though. You have to get a doctor that's trained in this, not that just went to a weekend course and such. I've taught this, that's worldwide. Please come in to Unison Pro-Youth Institute, to me, to Dr. Chris Rayo. It's a complimentary, no obligation consult. So come to find out if TRT, testosterone replacement therapy, is an option for you.